Welcome to another episode of NBS Podcast, NASA's Business Solutions. Don't forget, guys, this is so informative. And before we can even go inside, I want you to make sure that you subscribe, you like, and you comment, and you get a notepad. And also go to social media, right?
Yeah.
Facebook, TikTok.
Facebook, Instagram. So we all in all those links.
Exactly. Don't forget, guys, the podcast, we empower nurses to become successful entrepreneurs by providing resources, training, support tailored to their unique skills and experience.
Yes.
That's why it's important to take a notepad and make sure you get all the information that you're gonna receive here. And I know you're probably not looking at me because we're talking about nurses, right?
Yeah.
You're not looking at me. You're looking at this beautiful sister sitting next to me.
Yes.
You're looking at them, and obviously, we've got Sister Maureen over there. Sister Maureen, I mean, look at that.
Yes.
Right? And
Sister Maureen,
definitely,
the CEO of Exclusive Medical Agency,
Mhm.
the founder and the director of NBS, Nurse Business Solution.
Yeah, that's a nurse. Don't forget. I'm always surprised that it's a nurse, right?
Behind this beauty, there's a nurse.
Exactly.
Yes.
And the first episode, it was me and Sister Maureen talking about, what we're going to be bringing to the podcast, what we're going to be talking about furthermore, and also what NBS is all about, right?
Yes.
And we had a great one. And right now you're seeing in your face, Sister Tesh Mbata. Yeah. Yeah. I mean, you can see for yourself. She is a nurse. She is into business, and she's basically a partner in the NBS by supporting. I mean, sister, at this point,
So she comes
yes.
with the services that support NBS as an entity.
Definitely.
So what she does, she comes with the services like permits, Department of Health permits.
Yes.
How is sister, unyogobula clinic, you have to have a permit that is granted by the Department of Health. And she is here to help us with this. So she is partnering with NBS. Remember when I said last time, I said
Yes.
we've got services, we've got people that we are companies that we are partnered with that are bringing services that complete compliant, because
Just like she helps with
is very
compliance.
important.
Yes,
Yes.
yes.
So she is going to be our body that comes with all those services that are completing our members to be compliant.
Okay. We now becoming too formal, but let's get into Sister Tesh Mbata. Sister, you are looking beautiful here, listening to us talk. People, I bet you guys want to know, Uguti, what's going on. Who is Sister Tesh Mbata? I mean, also, by the way, that's a cool name, Tesh Mbata, sister. Yeah.
Utomile got accent.
Oh my word, where do I start? Who is
From the
Tash?
beginning.
Oh, Tash is an entrepreneur.
Yes.
Tash is a very resilient, someone who is into business. I'm someone who's very intentional. When I'm doing something, I'm doing it to my utmost best. Tash is I've got a very strong personality. Sometimes
I know that.
I get so intimidating, but I know it's my personality. I'm a very strong woman. I'm patient, and I love working with people. I think my weakness is working with people. I love people. I love helping people. I always say in my house, when someone is saying Tash, I would always say, I would respond to them saying, how can I help you? Because I love helping people. I enjoy, because I want to see people successful. I want to see people prosper. I want to see people flourishing.
Yes.
So Tash is your.
I mean, I'm getting so many
Tash
beautiful points. So resilient. You love people.
Yes, I'm a strong.
That's wonderful.
I'm a strong woman.
Yeah.
I don't give up. I'm a
Yes.
go-getter.
Mhm.
I always get what I want.
Jeez.
And
And you're so profound with who you are. Exactly.
yes, I'm beautiful. Yes,
Hey,
I'm
hey,
beautiful.
yeah.
I'm fearless.
True.
And
Definitely.
yeah, I think I'm about helping people.
Amen.
That's me. I'm about helping
I'm getting
people.
a story here, right? that most nurses have those qualities, beautiful qualities, right? But I ask myself, obviously, not all nurses have the same upbringing or the same story to say, when did I start becoming somebody that's caring, that loves people? How do you become shaped into this person that's so resilient, that loves people, that wants to help people? Is there a backstory there? Is it where you coming from? Or
I would say, yes, there is definitely a backstory. I would say being a first daughter,
oh,
looking after your siblings, the younger ones. So I think from there, I got that, that, nature of,
naturally.
the nurturing character, always, stretching out your hand to reach out to the younger ones in my family.
Became a part of you.
Yes, I think I took it from there, being the first
Also,
daughter.
that she's a nurse.
Yeah,
Remember what I said? A nurse is a mother.
definitely.
We are trained to help. We are trained to assist, to be with the patient.
Exactly.
Compassion, you understand?
Yes.
So
Being an advocate,
being an advocate, to listen to the patient, to actually sell yourself in the patient's conditions, to an extent that we cry with the patient. You understand my point? When she when she's talking about helping, what is NBS doing?
Exactly. It
helping.
automatically it goes into one in one.
Yes.
I want us to go into, as a nurse, you love your job, right? You love helping. You've got a very secure job. How do you then start now saying, you know what? I want to open my own.
This started a while ago. I think I was still a student. I was still a student by then. I told myself I'm not going to be employed. I'm not an employable type. I'm a leader.
Okay.
I'm a leader. I always say I'm a born leader. I always want to lead.
Okay.
So from there, I told myself, when I complete this, my studies, I'm definitely opening my own practice. So I'm a very intentional person. When I was still a student, but already I had intentions to start my own practice. I told myself if I have to work, it would be to
Moonlight. Do some overtime just
or just to
augment
get practice, just to get
Practical.
experience.
Yeah.
Yes, just to get experience, and then from there, I'm definitely starting my own practice. So this has been there. It's something that has been there. It's not something that I wasn't fed up by working in a hospital, but it was intentionally so that when I complete my studies, I'm starting my own practice.
Now that you're saying that, I then ask myself, right? Because NBS, it gives so many solutions to your dream, the dream that you had. Did you ever have maybe a hand, somebody to help you out? To say, you can actually be a nurse into business in the future. You don't have to be a nurse for the rest of your life, only working as a nurse, but you can also do business. Did you have somebody who told you that?
In my time, no.
Yes.
Remember, I started a while ago, 2017.
Jeez.
Then there wasn't.
How long time ago was that? How long have you?
I think 8 years.
Jeez, okay.
Yes,
She's been 8 years in the practice.
8 years in private practice,
Yeah.
17 years in being a nurse.
Wow.
No,
Remember the last time we spoke about?
Yes, that's what I want to. That is the point I want to bring right now because there was a question last time on our last episode. Kay was asking how much clinical experience do one needs before they open their practice, and I said no. The clinical experience is very much necessary. I would say 2 years. I'm so impressed. I'm so impressed by you having to have not work on the bedside. Go straight to opening your own clinic.
Yes.
You got that.
And remember, with nursing, the beauty of being a nurse is that you start your practicals whilst you are a student.
Yes.
Right?
Yes.
Whilst you are serving or whilst you are doing your studies or your degree or diploma, already you are placed in a hospital whereby you need to go and do your practicals. So you don't really need 10 years, 20 years, 30 years.
You're saying to us, it started when you were a student. What inspired you
What inspired
to ignore bedside rather to be owning your own practice?
I think what inspired me, I grew up in a family of entrepreneurs. My mom, though she was working 7-4 work job, but in she would have, be selling this and that. She was doing like jerseys. She had
The
machines.
sewing, yeah.
She was sewing jerseys, the pullovers for teachers and nurses. So I grew up in that family, and she used to have her sisters at my home to come and assist her while she's doing her 7-4 job. Then they continue with the sewing of the jerseys. She had machines. She was very industrious, my mom. So and my dad, during holidays, they were both working 7-4 job. So during holidays, they would take their buggy, go and work, transport people. So I grew up in that environment. And then my dad would come home and show us all the money that he had made from that kind of work that he was doing. So that inspired me. I was like, I don't want to be employed. I want this one.
Yeah.
I want to make money.
Which is very much impressive, Kay,
Yeah.
because she has used her skills.
Mm-hmm.
Remember when I say use your skill?
Exactly.
So she used the qualifications she obtained to venture into a business.
Yes, from the spirit, from the mother, the
yeah.
father, and
Yes,
it
and
is
then,
so yes.
the idea of nurses are underpaid and all of. She does not have that experience. She has been making money from the age of what, I don't know.
I go back to the question where I'm asking myself, like, I mean, as much as you said, I want to go into business. Yes, I'm studying nursing. I'm a nurse, but I want to go into business, right? Where does it begin? Because right now, I mean, Nurse Business Solutions has everything covered for you, right? Where do you then begin and say, look, I'm done now. Now I'm going into business. Did you start opening up a company, or did you maybe look at compliance? Did you, like, where did it begin for you?
Okay. I think when you are intentional about something, you do your own research.
Yeah.
So because I wanted this with every fiber of myself.
Yeah.
So I started to do my research, and I wanted to start big. I wanted my vision was a company.
Yes.
It was not necessarily a clinic. I didn't want to open a clinic there, somewhere there in the township. I had a vision of a company.
Okay.
But my company obviously is gonna be channeled to the health industry. It has to do with health.
Okay.
It has to be me.
Okay.
It has to be what I believe in, right?
Great.
So I did my research, and then I checked on the web. Remember, these days we've got all the information on Google.
Yes.
So I went on Google, checked, okay, how do I register a company? And then I found IPC. Then I registered my company.
Just like that.
Just like that.
That's bravery.
I registered my company. Okay, when I was going to start, I was going to start with my sister. She's also a nurse.
Okay, wonderful.
Yes, but then she was employed,
Okay.
government, and employee. And then because she was a government employee, she couldn't start with me. And I was like, girl, we are different people. You still want to go for employment? I am not that kind. I'm an employer. I'm an employer.
Yes.
So I pursued that. I registered a company, Mpata Health and Wellness Clinic, 2017, June.
Yes.
Actually, 31 of May,
Okay.
2017, my company was officially registered. Then I did SARS. I did everything, compliance. That's why I'm so passionate about compliance. And I know nurses, they just focus on the clinical part of it and not necessarily check things like compliance. Yes. So that's why I'm so passionate about business compliance, because it's something that I started with. I didn't start
just by going.
I started the right way. I just registered from the beginning. From this word go, I registered my company.
Yes.
I did all the necessary compliant stuff that I had to do.
So you basically did what 1.8 does Lanekaya. You're like, okay, cool. I'm gonna register my business. I'm gonna get my SARS done. What about funding? I mean, right now people are fortunate. NBS already has Standard Bank.
Yes. So all of what she mentioned,
Yes.
NBS is saying to nurses,
Yes.
come, we'll do all of this for you.
Mm.
You just pay a membership fee of 1,800
Yes.
and we will do all of this for you. Understand?
Yes.
She mentioned compliant. You have to have I actually want to emphasize on companies that are fully compliant before they start working.
Yes.
So that's what MBS is doing. You can't.
It's very important,
It's
right?
wrong. It's wrong. It's not
To
right.
start without
It's not right.
Very wrong, yeah.
Especially in our profession. You don't
Yeah.
know when the nursing council will knock at your door.
and you don't want to
Come-
risk
and
that.
You don't want to risk it because there's a lot of complications. There's
Mhm.
implications. What
Yes.
I mean to say, you understand? So please, I would want to advise people to actually take serious. Make sure that your business is compliant before you start operating.
Yes.
That's where NBS is coming. Understand?
No-
So
yes.
yeah, all of what she has done herself,
Yes.
we are saying, come, we'll do it for you.
That's why I'm so intrigued to say that if somebody, okay, cool. You coming from a place where mom, dad is doing business, right? But they are not doing anything to do with nursing, right? Their businesses are out of their profession. And then you go in, you register your business, you get compliance and stuff like that. How do you fund yourself to say, look, I'm gonna now start operating? How did you fund yourself?
How did I find myself?
Fund, yeah.
Okay.
Tricky.
Very tricky.
Yeah,
And I did fund myself.
Yes.
Okay, because then I was doing what you call locum, right? Because what I loved with locum is that there's no strings attached.
Oh,
Yeah.
I go, I work for you, you pay me for my hours.
that's the service of call.
That is what Exclusive Medical Agency is also doing. Remember, RMNS.
Yes.
I've got corporal. I've got a company
Yes.
that is doing placement of nurses in the hospital.
Yes.
So that's why it's called Exclusive Medical Agency. That's where you place nurses. That's what she was doing.
Exclusively. Oh.
So she had registered herself with an agency,
Yes.
and she was doing locums
Locum,
to be
yeah.
able to fund
Mm.
the a kickstart, like the start of the clinic.
How did you juggle the locums and also now funding my own business?
It actually gives you time because you go to a locum when you are available, when
Okay.
you
Yeah.
want to go.
Got you.
You are not you haven't signed a contract with anyone to say you'll be here at this time. It's your own terms, right? So other times I'll be doing stuff for my business. You know, people always laugh when I say when you were sleeping, I was not sleeping because I was doing my clinic documents.
Oh.
I haven't started at that time.
Yeah.
But already, you know, this passion, this thing was just burning within
Passion
me.
will drive.
I would wake up at night and be like, yo, I'm going to need a consent form. I'm going to need, and those are the things that I've
Clinical assessment
assisted
form, yeah.
others, people that are starting. I would just say, when they say they need a form, I would just give them. And I would just remember in my times, I had no one to, you know, give me those things.
Exactly.
I had to sit down,
Yeah.
take my computer, right?
Yes.
And start typing,
Got you.
you know. And I used the time that I was doing a locum to learn, because my locum was not necessarily in hospitals.
Okay.
Because I knew where I was going, that I want to be in the corporate, I want to be in private sector, in the private sector. So whenever I would go to that company, as much as I'm there to work, I am also there to learn.
Wonderful.
Right?
Wonderful.
I am also there to, you know, to be informed, to be empowered. So I used that time. So for me, it was not hard work necessarily,
Yes.
but I enjoyed it because it was empowering me as an entrepreneur at the same time. So if I would go to a big company, work there, as I would be so excited that, you know, one day this is where, you know.
Yeah.
So I would use every opportunity.
Okay.
If there's an OMP there, or like an occupational medical doctor or occupational health practitioner, which is very scarce, that I would find another occupational health nurse, but I would normally work with occupational medical doctors. And yes, and they inspired me as well.
I want to ask you a question related to this passion of business that you have, because I'm listening to you and I'm seeing somebody that's an entrepreneur before even the nurse, right? Where you have the spirit. But then I want to ask this particular question, especially to both you sisters, because I mean, you ladies are amazing, fire, like it's astonishing.
Yeah.
Because I've met so many nurses, but it's not many times where you would actually align them with entrepreneur and stuff like that, as much as they can sell Tupperware, this and that. But this is explosive, right? What is it in nursing, right? That I can start with you, sister. What is it in nursing that you have maybe identified that puts a lot of information into an entrepreneur? Like, is it easy? Or besides the fire, let me not even ask if it's easy. Besides the fire, what's there inside of nursing studies that can align with entrepreneurship?
You learn that practically when you are a nurse.
How so?
You have to actually tell your mind. You have to have the thoughts of entrepreneurship in you.
Okay.
You understand? You have to be a go-getter,
Okay.
as she is.
Yes.
You have to do a lot of research.
Yes.
Ne?
Yes.
Because I will give an example with me.
Mm-hmm.
I have been in the nursing space for 20 years.
Yes.
I've got bedside nursing for 20 years.
Mm.
In my 20 years of being a nurse, I have been a member of agency. I would belong to a certain agency working for someone.
Mm-hmm.
And then in that space as well, there was a time where I was managing units.
Okay.
You understand? I was unit manager. You understand?
Oh.
In that time, then I'm able to see a lot of wrongs.
Mm.
Understand?
That's the entrepreneurship mindset.
Yes. Then I'm saying, but one can do best. I mean, one can do right here, and the person who can do best here is a nurse.
Mm.
Because I'm still saying the people who should own hospital, it should be nurses.
True.
It should be people with medical experience.
Definitely.
Should be people who are exposed to the medical field. You understand? Mm-hmm. The nursing manager, hospital managers should be nurses. Because we know from holistically, we know the nursing quality care of patients.
Patients, yes.
You understand? Then from when the patient enters the hospital to when they go to the hospital bed to when they go home. You understand? You get to be involved in those areas until they go home. So, and then you try to make sure that they are happy, they are happy, you're giving the best services and all of that. Then that's where you actually start matching your entrepreneurship thoughts to say, hi,
Definitely.
I can do it and I can do it best. You understand?
So basically, when you are in there are bits and pieces that actually are of entrepreneurship. Basically, you can say, even if you go into any business besides nursing, you can actually give these type of qualities based on what you learned.
Let me give an example again. Before, sister, I worked in theater for 20 years.
That's true.
In theater, we do operations. You know, we operate. We've got different specialty. So there will be people coming from the companies, bringing the equipment, the tools, the screws, plate and screws, the tools that needs to be used on the patients. This is a company of someone who's not even in the medical space.
Exactly.
And I am the patient advocate. I'm scrapped on the table. I'm implanted. I'm busy utilizing this screws, instruments on the patient. And the person who's manufacturing this or who's doing this is not even a nurse.
And you can also know how to
and a complete pitch. And a complete pitch. I've scrapped here. And a complete pitch. I've scrapped for neurosurgeons. They know me. They know my quality. They know what I can do. Your best clients are your doctors.
Jeez. Yes. You are even able to upgrade them. Yes.
And just to add on what she has said, I would say the nursing environment, it actually, for me, it's just that nurses sometimes they're not aware.
Yes.
Or I don't even know how to put it. They're not aware. Every experience that we get in the nursing environment, for me, it pushes you to be an entrepreneur.
Mm-hmm. Like what?
Because number one, you are given a patient.
Got you.
right?
Mhm.
Whoever is given a patient, it means that person is above the patient.
Mm.
As long as you are a professional nurse
Yes.
in a hospital environment, whether private or public, you are in a leadership position.
Gotcha.
And as an entrepreneur, you need leadership
skills, yes.
right? And everything that is going to pass to the patient, it passes through a registered nurse.
Okay.
Whoever comes to the ward to see the nurse, they go through a professional nurse.
Mm.
There is no one who can, like, from the door directly to the patient. Whether it's a doctor, whether it's a physiotherapist, whether it's a dietitian,
nurse is the
whether it's the lady from the kitchen bringing, they must start.
nurse.
Yes,
Mm.
they start with you, or they start at you. So already you are in a leadership position. You are in a position to lead. You are in a position to influence. You are you will hear doctors when there's a new doctor in the unit,
Uh-huh.
they will advise him that, you know what, for your things to go right, please make sure that you are you and
Close to
yes,
this.
the unit manager or the sister in charge, whosoever. So I think the environment that we work in, it pushes us to be, entrepreneur, whether you like it or not.
Definitely.
It's just that sometimes we are, as nurses, I don't know, we just lay back
This goes to my point last time, Kay, when I said each and every nurse have aspect of business in them.
Yes.
You understand?
Yes.
You are able to think broader in
yeah.
terms of knowing how to augment your salary and make a living.
Definitely.
Understand?
Definitely.
Because especially if you are placed in a private hospital,
Mhm.
each and everything that you do in the hospital, you bill, you charge. And then, because remember I said to you, and I'm going to say this again, a hospital is a business.
Definitely.
Private hospital is
It's
a
a
business.
Definitely.
So someone it's the owner of that hospital that is making money. That's why we charge each and everything. So I mean, to become an entrepreneur as a nurse, it's very simple.
It is.
I mean,
It's very simple.
You ladies can say that, right? It's very simple, and I mean, it makes sense because you started to be a nurse. You have the qualities of entrepreneurship from what you're learning from the business, because you
Your
need to remove
knowledge.
the mind of this is just a profession. You need to understand that this is a business. But now we go back to understanding that whoever's watching this is a podcast that teaches you how to actually go into business. Nurses Business Solutions. Do not forget to subscribe, like, and share. But now I want to ask, this particular question. As much as NBS has got everything figured out and covered for you, right? And you don't have to go through these obstacles and issues. What are the most obstacles or troubles or things that you had to go through, when you were opening your own?
Okay, the obstacles, I think the first would be finances.
Okay.
Because remember, you need equipment, especially for my kind of
Services.
services. Because when I started,
Yeah.
I was just focusing on occupational health.
Okay.
And occupational health needs equipment.
Oh,
You just
okay.
cannot move without equipment.
Hmm.
So I think that was my challenge.
Gotcha.
I don't even want to say it was a problem. It was a challenge. But because I'm a networker, I understand that sometimes we don't need money, but we need a good network.
Mm-hmm.
So because I was doing locums and I had worked, because my locums was specifically in the occupational health space.
Okay.
So already I had created networks with doctors that had this equipment. And the relationship was so good that I didn't have to think twice when I had my first client.
Gee.
I had to make a few calls,
Yes.
say, Doc,
I
please
need this.
come
need
through
that.
for me. I need that, because that's why it's very important to be as professional be as professional. When you go do a locum, be a professional person, work to your utmost best. like you know, you need to know that I'm here to work. I'm not here to, you know,
Move around.
move
Hey,
around,
just
and
pass
build
time.
my phone.
Because to
Be
you,
there
it's
to
not,
work.
it's not only that you are working, you're
Yeah.
actually building it.
I'm building.
That's
So
what she's saying.
So for me, it was very easy because even the OMPs that I would go work, I would find them in that company doing work. They were like, when they got a job, they know who to call.
Yeah.
They call Tash. And I would say, Doc, no, I'm not available. Because remember, now I've got my own thing. They would say, Tash, I would pay you anything. I don't want someone else there. I want you, especially if they're not going to be there and they need someone who will also go there and represent them. So that kind of relationship, it helped me now in terms of funding. I'm honest when I say I literally started out of nothing, but because of the good network that I had, it made things simple for me.
So good network that she
Yeah.
had
Mhm.
made her to be able to establish and to start.
Yes.
We are saying we've got Standard Bank.
Mm-hmm.
Standard Bank that is actually giving a kickstart capital, which I didn't have. I did not have. You know, when you ask her about the challenges, in me, I've got the same challenges. Nurses, the biggest fear for our professionals, our nurses to start their own practices or companies is because they always say, how much do I need? How do I start? I don't have money. And yet they work night and day. You understand? They are in the hospital working night and day and then make it. So I think you need to come to a point where you adjust and tell your body that this is the time and I am ready and I'm doing it. You understand? Come to NBS. We've got a bank that will give you that kickstart. That's strategic.
I'll definitely come running, guys. Well, these are the things
We're gonna run.
These are the things we didn't have in our time.
Yes.
And now, the doors that have been opened, you know, by us who started then, are just amazing. So really, I wouldn't understand a nurse who says I can't start.
Thank
Like,
you.
why wouldn't you
Thank
start?
you.
Let's not pressurize them, right? There is something called doubt, right? You had doubts. I need you to tell me because right now somebody that's watching this, a nurse or somebody who is supposed to be a nurse, probably has those doubts, right? And right now, as much as this NBS that can sort those doubts out for you because they cover everything for you, what are those doubts that maybe somebody who's watching is having them right now? I'm a nurse, Mara. What were the doubts?
I think the
Lack of
doubts,
confidence.
it would be, what if I start and then it doesn't go well?
Did you have that doubt?
I think I did. I mean, it's only human. I think I did, but it goes back to what is it that you want?
True.
What is it that you believe? Like, do you what you want? What are your intentions? And has the people that have started already, have they ever failed in when they started? Because remember, you won't know until you start.
That is true.
Then I think those words pushed me to say, I'm starting. If I fail, I've got something to fall back on. I've got my degree.
Yes.
I can still go and look.
Exactly, go and
That's
work
what is
night.
nice about our profession. If there's no business, I call my sister here. Hey, girl, please give me little, you know. So that's what is nice about. You can't say with nursing. I always say, I've been preaching this ever since I started. That guys, let's start before we are being regulated. Just start, because now, if you are inside when we are regulated, you are safe.
You are safe.
Yes, you are safe.
Yes.
Let's start. And you are so fortunate because you've got us. We didn't have anybody, but now you've got NBS. There's a lot, guys. You've got Tash. You've got everyone to support you. Things that we didn't have. This is luxury.
Jeez, I'm thinking about it, and I'm so astonished by the fact that, right, if I have, like, right now, I'm thinking, if somebody is studying nursing and is gonna come across this, right, or somebody who is a nurse already and is coming across this, you literally have 100% chances, or let's say 90% chances, right, of making it as a person of value, or rather maybe making it in business. Why? Because sister says, in the beginning, I needed money, the doubt, how am I going to make it? I had to research, do this. Look, we come, I'm getting excited. We come and we say, pay 1.8.
1.850. Yeah.
Imagine.
Pay 1.850. You get your business registered. You get your taxes covered. You get an opportunity to get a funding with Standard Bank, right?
Yes. Yes.
And cool, you're not quitting your job yet, or maybe you are quitting your job. But remember, there's also exclusive medical agency where sister says, I was fortunate. I had this thing to say, if it doesn't work out, I can get locums. Everything is covered. You have your business running. If you are not employed full-time and you want to make your business successful, you can also supplement your startup funding with locums. Like, why is life becoming so easy?
It's so easy to
Very
nurses.
easy.
You know what?
Simple.
That's what I said to you, Kay, last
You
time.
know,
Our profession, guys. That's why you also asked me if I can maybe encourage someone to be a nurse. 100%.
Yeah.
110%. You know, because you know what? Things are coming right at your doorstep. Things are just coming for you. You understand? It's just for you to make up your mind.
Definitely.
At this moment, I think people have their pens and papers.
Yep.
Because I need those questions coming through. You understand? I don't want to hear a nurse. Are, how do I start? You understand? Yeah. I mean, I think nurses, I'm going to say this, nurses have the mentality or the sickness in us that we want to just level ourselves with poverty. You understand? Yes.
That breaks my heart.
Yes, that's very true. Because you just stay in that corner.
Yes.
You stay in that corner. You help people to pitch their products unaware. Unaware. And I'm very angry
Just
at that.
like this, when you say as a patient, oh, this is the best wound
Ben and wound product.
product, right?
Yes.
Ben and wound product, and if you use this, it'll help you to, heal your wound. Just like this one, definitely will help you. Actually, it'll help you heal your.
And by the way, this is our product.
Yeah, let's
This
go
is
out
our
there.
product. This
Let's
is
talk about that.
exclusive medical agency product.
Mm.
Remember, Sister Maureen is an entrepreneur.
Yeah, I mean, yeah.
Yeah.
Definitely. Just like you can be an
Yes.
yeah.
Yeah, just like anyone. You
Yeah.
understand? I just want to have people understanding me.
Okay.
That, okay, behind everything, I'm still a nurse.
Definitely.
Ne? But I've got my own company. I'm doing placement of nurses in the hospital. Guys, this is the high time nurses owns agencies.
Yeah.
Mm-hmm.
We
Definitely.
are here to correct mistakes. If you are not a nurse, you are not a nurse and own an agency. Kanjani. How do you know? How do you train? How do you support the hospital? How do you identify
How do you know the
mistakes?
needs?
How do you
The
know-
challenges of
how do-
those
how do you-
nurses.
How do you give that best quality nursing care? Do you understand? How do you follow up? You know, how do you go back to the patient?
It's like you're stealing from the net.
Yes. How do you train? How do you come up with channel of trainings if you are not educated?
Aish.
Do you understand my point?
And
So,
okay.
wait.
Okay, let's do that. Do that. Let's go.
Placement of nurses in the hospital. We have 7 hospitals, Gauteng and Limpopo.
Jeez.
We are growing and we are looking forward for that growth.
Mm.
And then we are in the distributing space. Guys, we've got products,
Okay.
medical suppliers. We supply products. This is one of our products.
Definitely.
We are not the manufacturer. We are the distributor. This is manufactured by a nurse, by the way.
Okay.
This product is NEPI coded. It is in the medical aid space and SAPRA licensed. This is the things that nurses don't know. You understand? And we are here to teach people. You see these hospital beds
Yes.
in the hospital that are supplied by a company.
Yes.
Why, as a nurse, why are you not supplying beds in the hospital? Show me why.
And they give tenders
Tell me
to
why.
just people who didn't even study
Yes,
anything about
yes.
it.
Why? Why are you not approaching the hospital? Because you've got qualities to approach the hospital. Men of approach. We are taught in the hospital, hierarchy structure. Where do you start?
Mm.
Do you understand? So I'm saying, guys, now I'm coming aggressively.
Yes.
I want nurses. I don't want people to sit ba re bona ha bana tjhelete. Ha gona nurse e sa tlo no bereka. Maureen is driving this. Maureen has got this phone and all of the. We can all own that those things.
Definitely.
We can all own the, and within our profession, we still respect our profession. I've worked in for 20 years, but I still can go and do overtime. Now it's even easier. I'll do overtime under my own company.
Yeah.
Definitely.
You know,
Exactly.
I do that.
I book myself.
I still do.
Talking about that.
I still do that.
Talking about you still doing that, right? I want to understand, how did you go from this background of entrepreneurship, right? And then your qualifications and as a nurse, right? How did you structure that to make it work out as a person who's who has the mind for an entrepreneur and who is in the profession of nursing? How did you structure it?
Okay,
To
I
work
would
best for you.
to work best for me. I intentionally looked for something that's gonna still be me as a nurse.
Oh.
I didn't look. I mean, there's
Smart.
there's everything that you can do there as an entrepreneur, but I said, you know what? I want to do something that's not gonna confuse people. That's not gonna confuse me. So I'm just going to follow
So
this the
Jeez.
passion that I already have
Wonderful.
in
Wonderful.
nursing,
yeah.
right? I remember when I like literally or like just told myself that now I am starting. And then I sat down and said to myself, I'm not going to do anything outside of health. Whatever I'm going to do in my business, it must be health
Felt
related.
orientated and related.
Yes, because I want to, I had this in me that I wanted to inspire. Because I remember when I really now saying like I'm starting, when I was doing my research, I went to the SANC website. Then when I got this statement there that said,
The policy that actually governs the professionals, private professionals. Hey?
You mean SANC?
Yeah, SANC.
It's a governing body. It's a governing body for nurses in South Africa.
I mean, the statement you are talking about that actually allows nurses to open their private practices as long as they do it within the scope of practice.
Okay.
So